so my first question to you is, can you please introduce yourself and tell us about your role?
So, my name is Andrea, and I'm a respiratory therapist. I work at the general campus of the Ottawa Hospital. My role is basically to treat, assess, and monitor patients who are having difficulty breathing.
So, Andrea, how has COVID-19 impacted your job?
Um, it has impacted almost every part of my job. When we first were watching the news and seeing what was happening in Europe, we obviously started to get a little stressed out, and we started to make plans. We were doing everything to protect ourselves and to make sure that we could treat a large number of patients in a short amount of time. The stress level was pretty high, got to be honest with you. But our management team, our team of physicians, they were there answering questions, talking to their colleagues in other countries. Our managers would be staying for the night shift so they could talk through what our plans were. It was just a wild ride, for sure. For the first couple of months, it was just a wild ride.
Yeah, and I can imagine the anticipation of waiting for, your first patient to come in or your first group of patients to come in would also be very stressful as well.
We just had no idea. We had no idea how many people were going to come, how sick they were going to be. Yeah, the anticipation was almost worse than actually like getting our first patient in the ICU and treating them.
Yeah, I can't even imagine sort of the stress levels. And now through your experience and through the course of the pandemic, what is like the biggest challenge that you find being at work?
I think the biggest challenge being at work is just knowing that like there are people that you don't want to give COVID to, and knowing that you still have to treat everyone else too, because by protecting myself, I'm protecting all my other patients as well.
And also, I can imagine protecting the people you live with too, right? Like, there's this whole other component that isn't often talked about. Like, when you're in a room with someone who's COVID positive, I mean, you still have to go home, right? Um, so, has that changed the way you think about how sort of you live and how you are just like in the world outside of work?
I don't have children. I just have my husband. And I mean, there have been days where I come home and I'm like, don't touch me. I need to go have a shower right away. And just stuff like that. It's definitely made my social life super tiny. I come home and I see my husband, and that's pretty much it. Yeah, it's protecting everyone all the time.
Yeah, I don't think we can think about how much extra that adds to your day, especially for the fact that if you're addressing emergency calls, you can't just walk in. You're going to be like, okay, now I have to put all of these things on, and I have to make sure I'm protecting myself and the patient. So, has there been anything unexpected or surprising about the virus that you didn't expect?
The most surprising thing is just who it affects more than others. I mean, we get told in the news that it affects old people, people with multiple health issues. And what we see sometimes is previously healthy patients, people who were totally fine at home, no other medical issues, get incredibly sick. And that's like pretty scary.
When you see that cases are starting to rise in Ottawa, obviously you follow the news or you might know sort of what's going on around you. Do you have any, like, what do you think when you see that, when the cases are starting to go up?
I worry that the operating rooms are going to close because there won't be enough beds. And I worry that people who need surgeries and need routine diagnostic testing are not going to get it because we need to divert all those resources into treating COVID patients. I worry that we're going to have to put 2 patients in 1 ICU room because we've run out of room. People need their routine surgeries. People need their routine diagnostic testing because cardiac issues that are curable, they don't go away. Cancer doesn't go away just because COVID is here.
Has there been anything that has given you hope about the the whole situation?
You know, when I got my first dose of the vaccine, that gave me huge hope because I think that's the way out of this is scientific progress and mass vaccination are going to help protect everyone from getting sick. And they're going to help loosen up all these restrictions that we have on people's movement and distance. So I can't wait, but we're all going to be really patient about it, and hopefully everyone is going to get vaccinated.
Yeah, that's an incredible message of hope. I would agree with that. Before I sort of close up with my final question, do you have anything to add just that I haven't touched on that you wanted to talk about?
At the beginning of the pandemic, we severely restricted the amount of visitors that were allowed to come in. No visitors were allowed to come in. And I think what was really hard was watching people in the ICU on a ventilator in their last days and not having any family around. And I think that was pretty hard for everyone. And just knowing that people were watching their family members for the last time over like a video chat, just it makes me realize the struggles that everyone has had to do is worth it, so no one has to watch their family member through a video screen as their last breath happens. That is just awful to see and witness.
Is there anything you're looking forward to, Andrea, after the pandemic's over?
Traveling. I canceled a bunch of trips. I was supposed to go to Hawaii. I've never been. I was supposed to go to the Grand Canyon. I've never been. So I just can't wait to see the world again. So, and yeah. Go home and kiss my mom.
Yeah, those two sound amazing. Not that I want to kiss your mom, but. And do you have, and Andrea, my last question is, do you have a message for Ottawa residents?
I think the biggest message I have is just be kind to each other, stay patient. We are slowly getting the vaccine. We will slowly dish it out to people, and there is a light there. It is going to happen. We're doing the right thing, but it's definitely hard. It's hard to stay. It's hard to do nothing. It's hard to do nothing. And wear a mask.
Truth. Oh, you're an amazing person. Thank you for taking the time to speak with us. The work you do is, I mean, I can't even really say it in words, but your work is valued. Your work is important. You've changed lives. You've saved lives. So, you know, amongst all of this, I hope that you feel gratitude from Ottawa. I hope you feel gratitude from public health because we appreciate you. Thank you for taking the time to speak with me today.
Oh, you're very welcome.